I'm Sarita Assouline. I'm a hematologist. I work in Montreal at the Jewish General Hospital, which is a McGill hospital. And I am study chair for AL6 and also a Canadian lead for the myeloMATCH platform of clinical trials for patients with acute myeloid leukemia and myelodysplastic syndrome.
My name's Lynn Savoie. I work in Calgary at the Tom Baker Cancer Centre and University of Calgary, and I am the Leukemia Committee co-chair, which also makes me a Canadian lead for the myeloMATCH NCTN clinical trial and the Canadian lead for AL6, which is one of the sub-studies of myeloMATCH.
myeloMATCH is a series of clinical trials looking at the treatment of patients with acute myeloid leukemia and myelodysplastic syndrome. And it came about because in the last several years there have been many developments in the understanding of the molecular drivers of acute myeloid leukemia. So myeloMATCH is a platform of multiple clinical trials that aims to treat patients based on the molecular drivers of their disease. Really, myeloMATCH starts from the time of diagnosis of either MDS or AML and tries to follow the patient along their entire disease trajectory.
Dr. Assouline mentioned there's a number of studies in AML, MDS. Within AML, it's split into older adults, younger adults, and within each of those groups of patients, there are a number of studies. I think myeloMATCH is important. It's exemplifying where the study of cancer is going right now, which is personalized medicine. Patients are very eager to have treatments that are directed to as specifically their disease as possible. But it also does involve agnostic studies such as ours, where if you don't have a specific mutation that has a target, currently there is still a study for you. It's going to be a rolling number of studies, and if there isn't one available at one point, it doesn't matter that myeloMATCH is done for you. You are on the books, if you will, and can come back if there's a study that pertains to you at a later part of a patient's journey.
AL6 is a clinical trial targeting younger patients with acute myeloid leukemia who don't have a targetable mutation. All the myeloMATCH studies and AL6 too compares these new approaches to the standard of care, so we'll have a very good understanding of whether the new therapies we're bringing in are truly better than the standard of care that we've been giving for 40 years. So I think that for patients who are considering the trial, it allows them to have access to therapies that might be better from an efficacy point of view, like working better on the leukemia, and maybe better from a safety point of view.